I sort of gave a version of this talk about 3 years ago, and not a lot had changed, except things are more certain and accelerating faster. Let me start by saying medicine today is better than it ever has been. And 10 years ago, it was better than it ever was then. So medicine has been improving, but it is incremental medicine, and it will keep improving. But let's talk about where we really are today, and as good as it feels, where things are. First, somebody actually, a physician, got up and challenged me on one of my talks on this statement. That's your below median physician. We do have obvious errors we know about, and I'm not going to spend a lot of time. This was a recent article showing that doctors are really bad at interpreting, understanding, reading results, images, whatever. The human doctors have cognitive limitations, cognitive biases. Those of you interested in that, Dr. Ioannidis at Stanford has done the best work on biases in human physicians. And when you look at 100 cases of diagnostic error, and there's a reference there, cognitive factors were responsible for a lot of those errors, and they can be eliminated. Premature closure, when a patient walks in the room, the doctor has already decided what they have, is one of those causes. In many of the diagnostic errors, high-value findings are already present that are missed. It's not like new diagnostic tests are needed. The AHA has something like 7,200 recommendations. Of the most important class of recommendations, class 1, 19% have level A evidence according to their assessment. Most of what we deal with in medicine is opinions. Good opinions based on the best experience we have. When things don't work, we improve them. But each expert has their own opinion. And one of my big beefs with medicine today is the treatment you get is based on the physician you get, not on the disease or problem you have. This is one of my favorites. This was an expert panel deciding an important critical issue on will procedure X cause bad consequences Y? And they were asked, this expert panel that actually made a decision on approving or not approving it was asked individually what the probability of problem Y was. The probability, that was the distribution they came up with. It's completely random. So, we're going to see this shift. It's so much fun to define the vision in 2050, but before I get to that, I think it's more important to make it understandable in small steps. And the best way I have of saying, where are we going? We have very good practice of medicine. It's improving every single day, but we need the science of medicine. And the science of medicine is a quantum leap above. And almost nothing, not 100%, but most of what med school students are learning today will be irrelevant to the science of medicine in 15, 20 years, maybe 25. That's the way to judge this new medicine. Machines will be better at integrative medicine. You won't need a cardiologist for one thing, an endocrinologist for something, making recommendations that are exactly opposite of each other. Across all symptoms, human behavior, human feel, human look, human voice, demeanor, thousands and thousands of data points, all the omics. And these machines will not only learn from all the data, they'll learn from the best physicians. The average patient will not be taking a median physician. They'll get the best. These AI physicians will read literature and understand literature. They'll look at the best practice among the best human doctors with the best results. They'll learn from them. So here's one way to think about it. This was close to my first cell phone. We'll start with clumsy point innovations, which is what we are seeing today. And it looked like, to us, like this phone. So, leading to discoveries that are right in front of us, and I'll give you a few examples that aren't obvious. So think about the progression of medicine in, whether it's 2 years or 4 years, timelines are impossible to predict. I mostly just speculate. Generations of medicine. And think of the phones, from the phone on the left to the brick on the right to the version 3, version 4, 5, 6, 7. You get the idea. That's how medicine will progress in 3-year increments. That'd be 25 years. It could be 35. It could be 15. Timing doesn't matter to me. In the interim, we will have upskilling of professionals. When I say 80% of what doctors do will be replaced, people get all upset. When I say nurses will be upskilled to do more than what a primary care physician can do, people get happy. But we will be upskilling people, we'll be upskilling physicians, nurses, leading to pretty large changes. And there's lots of innovation axes I won't go into today. Don't have time for. Why isn't this working? You get the idea. There's many technical breakthroughs that are going to cause this shift. And we are seeing some of it. We are seeing it in radiology. People laughed when I talked. 7 years ago, I wrote my blog called Do We Need Doctors in TechCrunch? It's worth reading, because I read it again, and there's nothing I want to change. This was implausible, and now it's broadly accepted as it is happening. Detecting AFib in a watch, but AliveCode just announced they can detect hyperkalemia, your blood potassium level, from the watch. That's pretty stunning, and there's more breakthroughs like that coming. Kaiser is one of the best protocols on how to use an old drug, statins, to reduce stroke death by 40% just through data science, just on the Kaiser data. There is no stroke drug that's as effective as just a change in protocol. We've all heard about Google AI. I won't spend time on it. This shift is happening. And I'm trying to give you a flavor of what each generation might look like. I do think most conversations between patients and doctors will happen with an AI first for the next 10, 15 years. They will intervene and know when to triage up to a real human physician. The quality of that triage function is what's more important than almost anything else. We'll see things like this. These are age, if you can't read it, age of an infant, and you can see microbiome diversity, predicting in advance whether this kid will have type 1 diabetes. Or this predicting what type of diabetes do you have. Denny Ausiello, who was chief of medicine at MGH, likes to say the term diabetes will go the way of dropsy, because it's not one disease, it's many diseases. Data science will differentiate the diseases not based on the symptoms, but the causes. Mental health, same thing. There's no reason we can't predict with phenotypic biomarkers how you use your cell phone, for example, whether you're going into a manic depressive episode or a bipolar episode hours in advance. So I've talked about it. I think everybody will have a new health kit at home and an AI nurse assistant, and then maybe even a nurse at your home when needed, DoorDash style, not bringing your food, but bringing medical care. The same cost level of online service today, food delivery, for example. So I'm giving you a sense of where this goes. I think within 10 to 15 years, almost every major specialty in medicine, I looked at this, and I have a 3-year-old paper I'll refer you to if you Google 20% doctor included. I actually, in the appendix, defined the specialties and say what will happen. Almost certainly, 80% of what a psychiatrist does can be done by an AI psychiatrist bionic assistant. Same is true of an oncologist. If anybody wants to start an AI oncologist company, call me. Same is true of cardiology and other specialties. By the way, primary care is going to be the most important specialty in medicine, in not being a specialty and being more integrative. Because the expertise in each of these areas will come to the primary care physician who won't need that detailed expertise. Data will provide new insights. We heard a little talk about Alzheimer's. You can't measure progression of Alzheimer's. But if you did do that, you could actually look at therapies. So companies like NeuroTrack are measuring progression rates. In an online game you play, you can do it every day, every week, every month. Now you can decide whether something's actually improving, whether exercise or no coffee or more coffee actually improves your disease and symptoms. Then companies like Alka-Hest are doing proteomics to say what changes, what increases your propensity to have Alzheimer's as you age. Those are the kinds of things that'll happen. Almost certainly, at some point, I think it's 25 years away, everybody will get thousands of data points a month, or at least reasonably frequency at such a low cost, it'd be free part of it'll be like your flu shot. It'll be monitoring instead of preventive, leading to new forms of diagnosis. When I say thousands of biomarkers, I'm talking about per blood sample you take at home, like a dried blood spot, costs no more than $5 to ship and get analyzed, or $20 to get the results back with interpretation. Those kinds of numbers. Lee Hood has talked about this. This is one of his slides. I think we will see holistic medicine. The human body is just about 3,000 metabolic pathways interacting in the same body at the same time. It's a network of things, not individual pathways, not individual biomarkers. Add to that the complexity of the brain, the electrophysiology of the human body, you're going to see network behavior across these modalities. Network medicine is a term that'll become much more important in my view. It's starting to be important. We'll do drug discovery with AI, not with humans. We'll use new modalities like microbiome much more effectively. And we'll probably have much more healthcare than sick care, which is what we have today. So, medicine will evolve almost everything about to the point where a consumer will have 24/7 all specialty care, and my personal goal is every human being has 24/7 primary care medicine available through an AI physician at some point in the next 10, 15 years. And I think it's not only possible, people are working on it. Anybody wants to work on it, call me. And we'll have new personalized medicine. It'll be predictive. And let me make this claim. Data science will do more for medicine than all the biological sciences combined. Hopefully somebody will challenge me. But I do want to make one more point. Traditional healthcare will also keep improving. And sometimes people confuse these two axes. Incremental medicine is incremental, but it is incrementally getting better and will continue to do that. I'm talking about a different curve imposed on the healthcare improvement curve. I'll be wrong on the specifics. I always say the future is impossible to forecast. I won't quote Yogi Berra. But we will have 5x reduction, what a doctor does, 5x increase in research opportunities, lower error rates, faster diagnosis, and more accessible. Technology in the past, especially incremental medicine, has always increased the cost of healthcare. I think that will change. And Mary Lou was a great example of that. Humans will matter because there is a human element to care. As I said to the dean of the medical school at Harvard about 4 years ago, I'd stop selecting for the smartest humans with the highest IQ. I'd go look at UCLA Film School because they're the best communicators. They have the most mirror neurons. You select students differently in a different world. So, predictability is very hard, so just a word of caution. But I will also say it will happen most likely outside the healthcare system. Walmart didn't innovate retail, Amazon did. Boeing and Lockheed didn't innovate space, SpaceX did. GM and Volkswagen didn't innovate cars, Tesla did. NBC and CBS didn't innovate media, YouTube and Facebook and Twitter did. I can't think of an example in the last 30 years where a large change came from an existing organization that understood the system. It's very counterintuitive. So, in the interest of time, I'm going to skip all this. But for those of you interested, I just did a document called Reinventing Societal Infrastructure. Healthcare is one of those components. I refer you to that. This is covered in great depth there. And I'll also just skip past our companies working in these areas, dramatically changing what they're doing, trying to do this vision that I defined 3 or 4 years ago. Why don't I stop here?
Thank you, Vinod. So in 2 minutes, maybe you've got an incredible portfolio. You've been catalyzing a lot of incredible companies, and some of them maybe even moving faster than you have. What might be a couple examples that might be illustrative to entrepreneurs and investors?
Well, surprising examples. What Mary Lou is doing, you already heard that. What Viome can do with microbiome, once you get 1 million samples, is pretty stunning. I think we'll discover a whole new branch of medicine. Microbiome transcriptomics, for example, will play together. AliveCore is doing hyperkalemia out of a watch. Nobody would have predicted it's even possible. Yeah, I have
my potassium's low.
Yeah, my potassium's low, or give me a warning early. Across the board, my son's working on a startup. And by the way, all these companies I mentioned are recruiting great chief medical officers, great product managers, great scientists, all looking. My son's building a primary care doctor who can text message back and forth, look at all your results. Those are just some of the examples. I think we will be stunned at where we are. We are Cube.bios in reinventing the annual physical. Completely worthless piece of expense today, costs $300, does nothing, repeatedly shown in studies. It should be quantitative and useful, for example. So I could go on for a long time. Maybe next year I'll talk about the companies and not the general slides.
Right. Thank you, Vinod.
Thank you.